All right. Hello, my name is Ariana, and I will be talking about my patient and her experience being pregnant during COVID 19. So, my patient is a 37-year-old Mexican and Caucasian woman who is 27 weeks along in her second pregnancy. She recently moved to Natomas 5 months ago with her husband and 4-year-old daughter. She has a 13-year-old stepdaughter that lives with them part time, and my patient works full time as a fundraising consultant and personal trainer. In terms of her daily life, she and her husband both work full time, but both of their jobs are flexible in that they're allowed to work from home. Her daughter attends preschool full time, and she exercises daily in both her work and spare time. And since they moved, they lack a support system since her parents live in Fresno while her husband's parents live in LA. In terms of stressors, her main concern right now is that her daughter's preschool can close at any time due to factors related to COVID 19. If one kid gets sick, then the school might shut down for a week, leaving her daughter without childcare. So, this would mean that she or her husband would have to watch her while they're supposed to be working. So, therefore, I gave her the NANDA nursing diagnosis of anxiety related to the instability of her daughter's preschool. She also has a history of breastfeeding challenges. With her daughter, she met with a lactation consultant and tried breastfeeding for about 2 weeks, but she was unable to produce enough milk and it became too stressful to continue. So I gave her the NANDA risk of effective breastfeeding related to her past history. Lastly, she mentioned that she's been having trouble sleeping for the past few weeks because she can't seem to get comfortable since her belly is growing bigger and bigger. So her NANDA would be sleep pattern disturbance secondary to pregnancy. In terms of my patient's anxiety, I recommend she find a backup source to watch her daughter if preschool closes. Because she doesn't have family around, it makes it harder. But there are nannies or babysitters who could fill in from time to time so that having that already set up would probably alleviate some of the stress she is experiencing around that. In terms of my patient's risk for ineffective breastfeeding, I recommend she consult with a lactation specialist prior to giving birth so she has the extra support set up and they can troubleshoot together if she experiences any difficulties again. In my teaching plan, I provided her with a list of things to do to increase milk supply. In terms of sleep pattern disturbance, I recommend she purchase a pregnancy pillow. It worked wonders for me. Also, to take Unisom at bedtime, which is a natural sleeping aid supplement that it contains melatonin and B6 and a few other things. And to avoid using electronics at bedtime, just to help her relax a little bit more. In the teaching plan, I included more tips and tricks to help her sleep. And here are the resources I provided my patient. It includes some mental health resources as well as support groups if she's experiencing any difficulties. It's just another way to connect to new moms as well. There's also a podcast. There's breastfeeding resources like La Leche League, some fitness and group classes. Even though she is a personal trainer, I just thought it's just another way to connect with moms. And just some general resources. A lot of them have to do with things to do with your kids in Sacramento, since she is new to the area, and just some other, behavioral health prevention services, just any postpartum resources she might need. So when I went to research articles related to COVID-19 and pregnancy, I did that before I interviewed my patient. So I was focused mainly on mental health just because it's such an important topic right now, especially related to COVID-19. even though my patient seems low risk for developing depression based on the Edinburgh Depression Scale I had her do. It's still important just to be aware of some of the issues that other pregnant women are facing during the pandemic. So this article, it's a cross-national study of factors associated with women's perinatal mental health and well-being during the pandemic. The goal of this study was to identify modifiable behaviors and cognitive factors which could help reduce mental health risk and improve well being among these women. In terms of the results, 43% scored above the cutoffs for elevated PTSD, 31% for anxiety and depression, and 53% for loneliness. 86% of the women reported being somewhat or very worried about COVID-19. So it's just important that public health and medical system interventions consider all of these stressors in order for prevention of not only the viral exposure itself, but just in relation to the mental health impact that it has on these women. The next article talks about the effectiveness of telehealth interventions for postpartum depression, and it did show that these telehealth interventions could significantly improve depression and anxiety symptoms. But it did not prove that the interventions would improve social support and reduce loneliness. So these would have to be addressed separately. The last article I did was elevated depression and anxiety symptoms among pregnant individuals during the pandemic. They were looking at COVID-19 and its effect on pregnant women. The participants reported high levels of depression, anxiety, and pregnancy-specific anxiety symptoms. And these higher symptoms were associated with more concern about the threats of COVID-19 to the life of the mom and baby, and concerns about not getting the necessary prenatal care, relationship strain, and social isolation due to the pandemic. So these levels, it's important to note, are much higher than those normally expected during pregnancy. Social support and physical activity appeared to be the protective resilience factors for these women. And most importantly, it's just crucial that these pregnant women feel supported during this time. So in conclusion, my patient has a low risk of postpartum depression, of developing it. But for her, she does have these anxieties about, childcare for her daughter. So finding alternate options would be beneficial. Improving her sleep and providing support for breastfeeding. Those will all help improve my patient's just well-being in general and decrease the risk of experiencing anxiety and depression. And for my patient, like one of the studies mentioned, exercise plays a very important role in her mental and physical well-being. And here are my references. And